Good morning, everybody. My name is Elliot Garza with MD Monthly. First of all, thank you so much for tuning in. This is, I believe, our third live stream segment that we are taking advantage of the digital platform world, coming to you live with any questions on preventive health care to health-related issues, the latest in technology. This morning, we're meeting with Texas Bariatric specialists here in San Antonio, Texas. They're in 5 markets. And we have several questions, a lot of interest in wanting to interview these doctors. They're also featured this past January in our MD Monthly cover. So I've built a very strong relationship with them as well. And again, from traditional, bringing it to digital, we have all formats as far as answering any questions that you want. So feel free, log on, ask questions away. I'm going to ask a few that are commonly asked as well too. And either Dr. Dill or Dr. Sabash will be ready to answer anything that we have going on when it comes to these type of questions. First of all, good morning, guys.
Good morning.
Good morning.
Thanks for having us.
Thanks for coming. So we're live. This is a little bit different, right? Mm-hmm. So we're live where it's candid, a little informal, by asking anything we want. But first of all, tell me a little bit about yourself, Dr. Reddy.
Yeah, I'm a general surgeon and then an added-on fellowship in minimal invasive bariatric surgery. What it means is do surgeries that helps to resolve a lot of comorbidities associated with excess weight. That's what we call as morbid obesity. So that's a specialized training I did, and that's what I practice. Most of my practice is bariatric surgery and some component of general surgery.
Awesome. And Dr. Dill, it was a pleasant surprise. We weren't sure we were going to have you this morning, and I'm glad that we're having 2 specialists here from the clinic talking about everything else. Dr. Dill, will you tell us a little about yourself as well?
Sure. I'm also a general and bariatric surgeon. Been in surgery about 8 years now since residency. And I've had an interest in weight loss surgery since residency. I did all my elective rotations in weight loss surgery and completed a mini fellowship as well as some training here with Dr. Patel for the last 3 years. And it's just been a very rewarding field. I really feel like we have a great impact on patients' health. When we treat the obesity, we get to treat all the other comorbid conditions. And so instead of treating someone with blood pressure medicine or diabetic medications on a monthly basis, and really just monitoring those disease processes and not really getting to cure them in a traditional sense with traditional medicine, with bariatric medicine and bariatric surgery, we're really able to get complete resolution of some of these comorbid conditions. So I really feel like we have a great impact on someone's overall health if we treat the obesity first. Mm-hmm.
It looks like we have some people actually tuning in, watching us. So thank you so much for tuning in. Again, I'll be looking at my phone. I'm not texting anybody. I'm just tuning in.
It's all right. We can understand.
I promise you I'm listening. But I'll be answering any questions that show up on here. But I have a couple of questions myself. Depending on who wants to answer them, but feel free and be as detailed as you want. Can weight loss surgery really cure diabetes?
Yeah, I think that's a great question because when this kind of surgery started, it was all promoted as a weight loss surgery. Let me get this point straight. It's not, weight loss is a secondary component of what we do. The primary benefit is medical conditions that's associated with this obesity. It's not just diabetes, hypertension, cholesterol, asthma, sleep apneas, fatty liver disease, many things. Among them, the most interesting one and most dreaded disease is diabetes, especially the type 2 diabetes. So definitely with this kind of a surgery, what we are talking about, like it could be a gastric bypass or a sleeve surgery or many innumerable other options that are popping up right now, which are limited studies, but the one which we know, there's a gastric bypass, sleeve, duodenal switch, that definitely helps in remission of diabetes. 80% to 85% is the resolution, and the remission is the remaining 20-25% completely. I mean, complete resolution of diabetes can be achieved up to 80%. Depending upon how they follow the program.
Okay.
So we have the long-term results which have been published in numerous journals and articles, and we have scientific evidence behind it. So there is a cure for the diabetes type 2 mellitus by undergoing this kind of a weight loss surgery.
I know, and that's good to know because, especially in South Texas, diabetes is something that we're trying to combat all the time. I mean, there's different ways, and I'm glad that we're here asking you these type of questions. It's a relevant question for a lot of Hispanic families, especially in my family as well too. My father's diabetic and what have you. So it's nice to know that there's type of things that preventive wise that we can, or you guys can take advantage.
So that's what you mentioned. That's a great point. When you said the preventive surgery, I like the word when you say preventive. It's a preventive surgery. It's not like people have surgery for a cancer. That cancer is already there, so you're treating. But this is a preventive surgery, and people should know that thing. That's a great point what you mentioned. Yeah.
I would agree with that. You know, it's really, I think sometimes such a shame when we see someone so late in life and they come to us for bariatric surgery and they've already had all these diabetic complications. So they've had amputation, they've had vision problems, kidney trouble, heart attacks. They've had all these other health conditions that have came over time. Whereas if we could have just treated that patient in their 30s or 40s, or sometimes we treat people in their 20s as well, we can help avoid all those complications and just start a different train of path for their whole health for the rest of their lives.
So education, awareness.
Most important, you're right, the education and awareness. I mean, right now, more and more PCPs are getting to know what we are doing right now, but still there is a lot of stigma associated with this one. What do you mean by stigma? It means like the primary care doctors are just a little bit scared talking about their excess weight to the patients. But now we are educating them, saying that it's not the excess weight, it's the medical conditions that are associated with the excess weight. So now there are more and more people are getting educated. I think that's a great point. We need to educate the families, friends.
Exactly. You know, and the cultural aspect as well too needs to change a little bit when it comes to our way of thinking and growing up. And I'm a lot more aware of my daughter, what she's eating and what have you as well too. There's other common questions that are often asked. Here's one that's, I've tried numerous diets and exercise, but can't seem to maintain weight loss. Are there any other causes of obesity?
Oh, that's one more very interesting question because because a lot of people who come to us, they already have tried these things. Throughout their lifespan, they're like skipping the diets, doing the Atkins diet, doing this kind of diet, doing that kind of diet, go to the gym, pay a lot of money to the gym. They've tried this. Nothing works. That's true. Even by the scientific evidence, we know that the medical weight loss, even with the medication, currently the success rate is less than 5%. I say less than 5%. The only thing that can work as of now, based on my scientific evidence of the literature, what we have is a bariatric surgery. That's a metabolic surgery. I call it as a metabolic surgery. So the reason is it's not just the diet. You might have seen like there are people who eat like 4,000 calories of food per day, but still they don't gain the weight. So it means it's not just the diet, right? So there is a lot of things associated with the diet. It's your genes, it's your surrounding, the the environment, what we're growing up right now. I mean, we did not have this obesity 30 or 40 years ago, right? People were eating, doing all kind of similar work, but now it's growing. Why is that? It's just because of the stress, sleep, the medications that are in the market.
Lifestyle.
Yeah, lifestyle changes. There are multiple factors associated with this. We had the same genes just like our grandfathers, but why they're not obese? Why are we obese now? That's a great point. It's a very complex disease process. What we know is since 1980s, the obesity is doubled, not just in the United States, it's throughout the world. Yeah, people are getting more, having diabetes, hypertension, heart disease, even at a younger age, okay? So that's the reason, there are multiple studies looking into this one, mainly what you said, like lifestyle changes, environmental factors, and they try to test, there are some genes, variants which are associated with obesity, and they have done numerous studies, and it proves that the Western environment and your lack of physical activity, combination of multiple factors, so you become obese. It's just like not just one factor. It needs to be a perfect storm. So that.
You know, Dr. Dale, as far as the patients, and you guys see many patients, not just in Texas, but out of Texas, I'm assuming coming too as well, for your expertise. What is a common factor what's their main concern? When it comes to, is it obesity? Is it diabetes? Is it a back problem? Or
I would say overall it's just their fear for their health, or maybe they come to us because they have a new diagnosis of diabetes, and so maybe they haven't seen their primary care doctor in a while, and then they go to their doctor and discover, oh my goodness, I'm diabetic and I've been put on blood pressure medicine, and it's kind of this wake-up call of, oh my goodness, I'm not as healthy as I once thought I was. And I think for a lot of Americans, you see people who are overweight all the time, and we get really used to seeing that. You think, I'm okay, being a little bit overweight, but we really don't some patients just really don't understand how much that weight really does affect their overall health. And it may not affect them right away. You know, we can have patients that don't have diabetes or have high blood pressure at a younger age, but yet, you know, given this problem decades down the road, they'll certainly start to see that. But I would say it's their overall health. Most people don't come to us for a cosmetic concern.
Okay.
So that's
true.
important to document, you know, to let people know. This is not, you know, for a cosmesis. This is not a superficial thing that we're treating. We're really trying to treat a metabolic illness. And with treating the obesity with bariatric surgery, that's really how we're able to conquer that whole problem.
I find that very interesting because, I mean, I'm glad you're making the difference. It's not a cosmetic. It's
Yeah,
more
sure.
of a preventive health,
Yeah.
better lifestyle.
That's a great
And
point.
improved cosmesis, of
Yes.
course, comes,
Yes.
and patients have improved confidence, and they're able to do more and become more
Psychological,
active.
too.
Oh yeah.
Oh my God,
Yeah,
that's a big
so
factor
it's-
too.
It's so rewarding just getting to work with these people. You really give them one tool to help them be successful. And for a lot of these patients, they're successful in all areas of their lives except this one. So it's not laziness. It's not lack of willpower. It's nothing like that's happening because they're successful. They're in business. They do things. They have families that they support. They do a lot of things very well. And it's just one aspect of their life that they really just struggle with because of all these other factors that Dr. Reddy commented on.
I think the most important thing is quality of life. You mentioned your lifestyle gets better. The quality of life significantly improves. Imagine like extra 100 pounds you're carrying every single day. I mean, if you lose those extra 100 pounds, you become much more athletic. You just do what you really wanted to do in your life. I mean, imagine. I mean, it's not just equality too. Your lifespan is increased. Again, I'm not just telling you certain things. This is all science. Your lifespan is increased. You prevent certain cancer disease too. It's been studied. Yeah.
Let me ask you something, and without mentioning any names, well, what patient has a good testimonial that you can relate to? Someone that you've continued seeing, they've lost weight, and tell me about that person.
Yeah, let me begin this way. I mean, the reason why I was interested in the bariatric surgery is back during my training, I had seen a few patients that really changed me how I should look into this bariatric surgery field. During my training, during the Cleveland Clinic where I was trained to, part of the residency was done in California, Santa Barbara too. So there had like few patients, young patients, I mean like 450 pounds. And they're like 21, the college, a lot of shaming in the college.
450 pounds?
Yeah,
Okay.
350 pounds, 400 pounds, 450 pounds, a lot of shaming in the college when the 21-year-old, irregular menstrual cycles. And then she was seeing the many weight loss physicians. She reached 23, I think. 2 years, she tried all kind of diet, exercise, nothing worked out. Then she came in and she really loved kids. She wanted to have kids and she was diagnosed with PCOS. Okay. I mean, I love kids too. Okay. It's a polycystic ovarian syndrome where it's one of the risk factors where people with an excess weight, they will have hormonal imbalance that affects their menstrual cycles, and it's one of the big reasons for infertility in young women. And so by doing this bariatric surgery, within 1 year, she lost probably 65 to 70% of the excess weight. And you never know. I mean, I saw it during my 5th year and she had conceived. I mean, that was surprising. I mean, I'm not telling that this is my biggest life-changing event, but I went through that emotional, I've seen her multiple times in the office visits too. I mean, you could see her every time when she lost weight, you could see the smile, you could see the family are very happy and a lot of things. That's one thing. And then there was other patient with multiple, he had heart stents and diabetes, hypertension. Post-resolution, I mean, you could see how fit he was. I thought, what other surgery can cure this kind of diseases? What other surgery can make people so happy? So they were depressed. Okay, they even did not want to come outside their house. Okay, it was difficult for them to get inside the car. It was difficult for them to get out of the car. Every single event in their lifespan was painful. So once they did the surgery, they were so happy. I thought, if I want to do this, I think this is my surgery. And it's a laparoscopic surgery. We all do with small incisions.
Yeah, I like that story. And it's self-rewarding as well. You love seeing those type of
exactly.
Successes. And I have a question here from Janine Dixon. Hi, Janine. Is there an age limit when it comes to these type of surgeries?
Not really an age limit per se. We treat patients up into their 70s, I would say, but there gets to be a point where we consider the quality of life and the potential length of lifespan versus the risk of surgery at someone's age. So I would say we've done surgery on patients who are in their 70s, but getting the upper 70s and things, we really have to consider. Is the surgery going to increase the risk of events after surgery versus what's their quality of life and increased lifespan after that?
Yeah, I think that's a great point. What you mentioned, that's right. I mean, upper 70, depending upon how they are. I mean, if they look pretty good, like pretty active, I think the upper 70s is like reasonable cutoff. Again, we just not go with the age. We look into the multiple factors.
Right.
Yeah. And
We
if
want to
they're
make
really-
sure
yeah.
surgery is safe for someone.
So the risk benefits, obviously.
Yeah.
And the youngest age is probably like we say the skeletal maturity. If they're skeletal mature enough, we do the surgery means like usually around 16. And that involves like pediatricians, pediatric endocrine physicians, everybody. We sit as a team and then we make the final decision whether this kid has to have a surgery or not.
What advice would you give someone who's had weight loss surgery and they want to come back? I'm assuming it's why does it happen? Was it successful, or how does that work?
There's a lot of factors that can play a role,
Okay.
and the people who tend to do the best after weight loss surgery have close follow-up with their physicians. So we really try to stress to our patients, we really want to see you on a regular basis, particularly in that first year. And then if you're doing well and things are great, then we'll see you on a yearly basis after that.
Well, there's definitely homework involved.
Absolutely.
Yeah.
Yeah, so the surgery is just one tool, and so that's one aspect. But of course, the diet is important, and getting in some activity is important. And so trying to be more active and do things as the weight is coming off and there's less pain in the joints and patients are able to move around a little bit better. We do want to encourage some of those things because it's going to help them reach their goals a little bit quicker and help them maintain their weight loss.
I think that's a great point. I think add on to that, usually what I see them as when they come back after the initial weight regain, I usually see start with like, why is that?
Why is
is there a real follow-up? If they had a real follow-up, if they had a good follow-up, then I need to think about, okay, is it something wrong with the surgery or something going wrong with the surgery? Or is it just the patient related? Or it's something new medications the patient is on? That's the reason weight is coming up. So we need to look into every aspect of it. It could be because of the surgery. Sometimes there are issues with something happens with the surgery, right? You drive in a perfect nice car, you still get an accident, okay? There are situations like that. We do work up, make sure that surgery standpoint itself is correct. Okay, if that is correct, then we discuss with the patient, why is that? Is it more of psychological? Is the patient eating because of boredom? Is it just because she's stressed enough or he is stressed enough? That's the reason he's eating on that? Or what is that wrong? We just sit down with them and then we start over again. Okay, sometimes it could be just medications. Their primary doctors have started new medications and they did not know that they're increasing the appetite of the patient. So we just look into all these factors and then help the patient.
Yeah. All this, it's changed a lot from I guess 10, 15. How long has this been a procedure or process?
Decades.
Decades.
Yeah. So it started, I think, back like in early 1970s, 80s.
Wow.
It started with it was not intended for a weight loss procedure to begin with. It was an ulcer operation. They tried to treat the ulcers. They tried to remove the portion of stomach. And patients started losing weight, their diabetes was getting better. I said, what the hell? I do an ulcer surgery and now we are losing patients and diabetes is getting cured. This is just like an invention. Just like that. There is a story behind each surgery. And the most important triggering factor is in early 90s. Before that, it was all big surgeries.
Yes.
In early 90s, physician from California, surgeon from California, he started doing the laparoscopic surgery. So from there it started. And then
so much advancement.
Yeah, exactly.
Oh, yes.
Yeah.
It makes for an easier recovery, a shorter hospital stay. Patients can get back to work a lot quicker.
Yes. So it's get back to work a lot quicker. Is it an inpatient or outpatient thing? How does?
Usually inpatient,
Okay.
usually 1 or 2 night stay, depending on what type of surgery it is. We may be getting, as technology progresses and we advance our protocols, we might be looking into more of outpatient based in the future. But currently our program involves a hospital stay.
Depending on what procedure, correct?
Right,
Yeah.
right.
And tell me a little bit, give me a couple examples of procedures. What other?
So the most commonly performed ones are the Roux-en-Y gastric bypass surgery and the laparoscopic sleeve procedure, the sleeve gastrectomy. The lap band is fallen out of favor for a lot of bariatric surgeons, so not as many lap band operations are performed now as they used to be. So now the most common procedure is actually the sleeve and the bypass. And so for the sleeve operations, typically patients could spend 1 night in the hospital, and with our bypass patients, they usually stay 2 nights in the hospital. But they're all done with laparoscopic, small little incisions. So the getting back to work aspect is about the same no matter what type of surgery someone has, and it depends on what they do for their work. So if they have a really active job, they've got to be lifting heavy things or bending or standing all day, then we usually say you're going to probably need to take 2 weeks off of work. If someone has a job where they sit at a desk and do some computer work, they can probably be back to work in as soon as 4 to 7 days.
Okay.
So.
One of the questions, it's very enticing, especially people who are needing these type of surgeries.
Mm-hmm.
I guess one is expense, insurance. How does it get covered? Is it covered by insurance? Is it all cash basis? How does that work out for the patient?
I think most of insurance covers 80%. I would say the 80% will have insurance coverage, and some of them we have to prove it ourselves, saying that it's a medical necessity. We have a guideline saying that a BMI of 35, BMI is just like a number which we get from calculating based on the weight and height. If the BMI is more than 35 and having set of medical conditions, and that's insurance requirements, if they meet it, they get approved for the surgery. Or if the BMI is more than 40, with or without medical conditions, they get approved as of now. So most of the insurances say about 80% cover, and the rest, some 20%, you don't have coverage. We give them different options in regards to either the cash pay or how they can accommodate. There are different options for them to pay back.
Okay.
But most important is here you're getting your life back.
Yes.
Yeah.
And it's definitely worth the investment
Yeah.
and the time.
Absolutely.
Yeah, absolutely.
It's your
Absolutely.
life. You
Yeah.
really
Right.
can't put a price on that.
That's the thing. That's what I keep telling. The one simple analog which I try to give to every patient who walks inside our office is: imagine if you have a small car. If you put too much weight in the car, what happens? You break your transmission.
Mhm.
You break your axle, right? What do? Don't keep fixing the axle. You don't keep fixing the transmission. You take the weight off.
Mm-hmm.
Okay. So why can't you invest in this?
Yeah, exactly. You got to make that work. This is good information, guys. The live stream aspect is new to our industry, is new to the economy and everything else.
Mm-hmm.
But getting this type of information out to the general public is very important. It's informative. Those who are not live on us right now, even after this segment's going to be running through our site. So if there's any additional questions you want to ask, looks like you have a fan base. Someone just, Brenda Barraza, Dr. Dale's a great surgeon.
Oh, thank you.
There you go.
Janelle also commented on there, and she's just reiterating what you guys are talking about too. So
Thank you.
It just goes a long way,
Yeah.
especially with testimonials and making the efforts of making this world a little bit more easier to live in.
Mm-hmm.
Because stress and being uncomfortable, it's not a way of life.
No.
And I'm assuming too, it affects your sleep too.
Yeah.
Oh, yeah.
You want to know a little bit about that as far as sleep?
Yeah, so sleep apnea is something that's very common in the obese population. And so when you have sleep apnea, you actually have pauses where you don't breathe as well while you're sleeping. And then that puts extra strain on your heart and lungs. And so if you imagine trying to hold your breath for half of the night, you don't really wake up very rested. So it's like you've been swimming all night or doing some physical activity. And so then you're tired throughout the day, you're taking caffeine, you're doing other things to try to help with your energy. So sleep apnea is something that can be treated with CPAP or different devices, but ultimately weight loss can really affect that to where people don't have to have those types of machines or supplement types of equipment.
That's a silent killer. I call it as a silent killer disease. Not many people know this thing. They have sleep apnea. Oh, I sleep well. Snoring, everybody snores. What's there in it? Okay, that's normal. Even I snore. But the problem is not just snoring, right? It's just like your muscles in the neck because of the excess fat.
I've heard.
Yeah.
Do people actually stop breathing
Yes.
seconds at a time?
Literally, yeah.
Yeah.
Literally, they stop breathing, and if there are partners, they can notice. But sometimes, most of them, it goes unnoticed. They usually have headaches during the daytime. They get headaches.
during
Yeah,
the day.
they get headaches during the daytime. They feel weak and tired entire day. That's like common symptoms, subtle symptoms. Early in the disease process, we need to catch them right there and start giving them extra oxygen, which is needed at night time. until unless they have a weight loss procedure, then definitely the sleep apnea can be cured. That's pretty silent killer there.
Y'all's practice locations, where do you have your clinics at? How many clinics do y'all have throughout Texas?
Ooh, haven't counted in a while, but we have satellite clinics in Killeen and 2 clinics in Austin,
2 in Austin.
New Braunfels, Corpus Christi, Del Rio, Laredo.
Yeah.
What am I missing?
San Angelo?
San Angelo.
San Angelo,
Okay.
Yeah.
and of course San Antonio.
Yeah. San Antonio here, the main office is on the Huebner, and we have a clinic in the Westover too, Santa Rosa Cristos. But what's the point? Why do you, I mean, what the hell are your doctors are so busy? No, it's not like that, because we go to the patients.
Yes.
Okay, the surgeries are done here.
Yes.
It makes them less, traveling time for them. We go there so that we
Yes.
can,
It's
easily be
because we
connected to
believe in
people,
good follow-up.
Yeah.
And so if we come to the patients where they have access to us, they're going to be more likely to have follow-up, and follow-up equals success.
Yeah, that's a great point. That's a valid point.
Mm-hmm.
As long as you have a good follow-up, I think we can help you throughout the process. Yeah, that's a great
Well,
point.
hence why we have this segment called Ask the Experts. And, I want the general public or the future patient to feel comfortable who they're going to be coming to see.
Sure.
And you guys have been very welcoming and warm and informative on everything that we've been discussing. Is there any offers, or is there offers that you guys provide when people come in? I mean, as far as...
Well, we always have free seminars
Okay.
that are available. So if you go onto our website, TexasBariatricSpecialist.com, you can log in and register for a free seminar, and then you can come in. We give an explanation of the different types of surgeries. We talk about the process, introduce the members of our team. And then at the end of the seminar, patients then have the opportunity to stay and have a one-on-one consultation with one of us, and kind of talk a little bit more specifically about their health conditions, talk about their insurance plan, see if that's something that's going to be feasible for them. But, seminars are free. Never hurts to just come and gain some information. Yeah.
Awesome. Well, the other third surgeon is Dr. Nilesh Patel, who's also a personal friend of mine. I've seen his practice grow with you colleagues as well too, and congratulations on everything you guys are doing.
Thank you.
So we have Dr. Dill and Dr. Reddy. Dr. Reddy's always ready. I know you probably-
There we go. I'm always ready.
I know, trying to be funny on live Facebook here. But contact information, their number is 877-459-7065. That's 877-459-7065. Their business hours, correct me if I'm wrong, are 8:30 to 5 p.m., correct? And or on site, you can also locate them on the web, bypassdoc.com.
TexasBariatricSpecialist.com.
TexasBariatricSpecialist.com.
That would work too.
Yeah, that's other way. You can
Yeah.
reach us bypassdoc.com or TexasBariatricSpecialist.com.
Okay.
Yeah.
Well, thank you so much, guys.
All right.
Thank
Thank
you.
you. Enjoy
Thank
it.
you.
Y'all have a blessed day.
Thank you.
Thank you, everybody, for tuning in.
Thank you,
Again,
guys.
the questions
Thanks.
will get answered continuously throughout the day and tomorrow as well too. 2 weeks we'll be back with another segment on another Ask the Expert Physician, and I greatly appreciate you following us. Thank you so much.